this was somewhat surprising. We know in clinical Alzheimer's disease, or people who die with clinical Alzheimer's disease, when we look at the transcriptome of their brain, there's evidence for microglial activation. And in our mouse models, as soon as amyloid deposits, or in some cases, we didn't look before amyloid deposited in ours, but the very early stages, we could see evidence for microglial activation and immune activation in general. And that amplifies over time in the mouse model. But there's people who have come to autopsy who only have amyloid. They don't have Alzheimer's disease. They were controls because they weren't cognitively impaired, at least obviously. They weren't clinically tested. But when you look using those same methods, which we know are sensitive enough to detect microglial activation states, we see no evidence for microglial activation. And that sort of surprised me because I've been in the field a long time, and I just always assumed that in that earliest stage, you'd get microglial activation sufficient to see at that level. And again, this is based on fewer cases than the Alzheimer's disease. So we need to do more, and we need to look more broadly across multiple regions of the brain. But it really speaks also to the fact that we lack good biomarkers in humans for truly understanding microglial activation states or following them. The PET ligands that have been developed for microglial activation really aren't very sensitive to this in humans, and we need better both imaging and fluid biomarkers for this, I think. And that's, I think, the lesson, if any major lesson we learned from anti-beta and anti-tau immunotherapies is we have to have linked biomarkers to assess that you're actually doing something in humans, or else you're probably wasting your time, your money, and patients' time and money and putting them at unnecessary risk.